Tinnitus and PTSD. How Ginkgo Biloba supplements may provide relief. When considering Ginkgo Biloba for tinnitus related to PTSD, veterans often have specific questions about implementation, effectiveness, and safety. These questions reflect the unique concerns of those navigating both the VA healthcare system and managing complex post-service health conditions. The following answers provide guidance based on current clinical understanding and research. It's important to remember that individual responses to ginkgo and other natural approaches vary significantly. What works well for one veteran may not provide the same relief for another, emphasizing the need for personalized approaches and close monitoring when trying new supplements. How quickly can I expect Ginkgo Biloba to work for my tinnitus? Ginkgo Biloba typically requires consistent use over an extended period before noticeable benefits for tinnitus may appear. Most clinical studies that showed positive results used treatment periods of 8 to 12 weeks minimum. Unlike pharmaceutical medications that often work quickly, herbal supplements like ginkgo work through cumulative effects on circulation and cellular function. Some veterans report subtle improvements in tinnitus within 4 to 6 weeks, while others may need 3 to 4 months of regular supplementation before determining whether it's effective for their symptoms. For this reason, patience and consistent use are essential when trying ginkgo for tinnitus related to PTSD. Can I take Ginkgo Biloba if I'm on VA-prescribed medications? Ginkgo Biloba can interact with several medications commonly prescribed to veterans with PTSD and tinnitus. Of particular concern are interactions with blood thinners like warfarin, antiplatelet drugs like clopidogrel, certain antidepressants, and some seizure medications. Because ginkgo has mild blood-thinning properties, combining it with other medications that affect blood clotting can potentially increase bleeding risk. An important consideration for veterans with trauma-related injuries or those preparing for medical procedures. For additional insights, explore tinnitus relief for veterans and how cognitive behavioral therapy plays a role. Always consult with your VA healthcare provider or pharmacist before adding ginkgo to your regimen. Bring a complete list of all medications and supplements you're currently taking, including over-the-counter products. Some VA facilities have integrative health specialists who can provide specific guidance on safely incorporating ginkgo, alongside conventional treatments for both PTSD and tinnitus, including cognitive behavioral therapy. What's the difference between regular ginkgo and standardized extract? Standardized Ginkgo Biloba extract represents a significant advancement over basic ginkgo supplements. These standardized formulations contain precise amounts of the active compounds, typically 24% flavonoid glycosides and 6% terpene lactones, which are the constituents responsible for ginkgo's therapeutic effects. This standardization ensures consistent potency and reliable dosing, which is essential for evaluating effectiveness for conditions like tinnitus. In contrast, non-standardized ginkgo products may contain varying amounts of active compounds, making their effects unpredictable and potentially less beneficial. When selecting a ginkgo supplement for tinnitus, look for products labeled as standardized extract that specifically mention the percentages of flavonoid glycosides, 24%, and terpene lactones, 6%. These are the formulations used in most clinical research showing benefits for circulatory and neurological conditions. American Botanical Council. The extraction method also matters significantly. High-quality ginkgo supplements use specialized extraction processes that concentrate the beneficial compounds while removing potential toxins like ginkgolic acids. When purchasing ginkgo supplements, look for products that specify their standardization ratios and ideally have undergone third-party testing for purity and potency. For veterans concerned about supplement quality, consult with a healthcare provider knowledgeable about herbal medicine who can recommend reputable brands. Most research showing potential benefits for tinnitus has used standardized extracts at doses of 120 to 140 mg daily, divided into 2 or 3 doses. This standardization is particularly important for veterans with PTSD, who may be more sensitive to variations in supplement effects due to their hypervigilant nervous system state. Is Ginkgo Biloba covered by VA benefits? Currently, the VA does not typically cover Ginkgo Biloba supplements through standard prescription benefits, as herbal supplements generally fall outside conventional pharmaceutical formularies. However, some VA facilities have integrated health programs that may provide access to certain evidence-informed supplements as part of comprehensive care plans. Veterans enrolled in VA whole health programs might find that ginkgo is available through these specialized services, particularly when conventional treatments for tinnitus have proven insufficient. Some veterans may qualify for reimbursement through VA flexible spending accounts or health savings accounts if ginkgo is recommended by a healthcare provider for a specific medical condition. Documentation from your provider regarding the medical necessity of ginkgo for managing service-connected tinnitus can sometimes help with coverage appeals or reimbursement requests. Ask about whole health programs at your local VA facility. Inquire about clinical trials studying ginkgo for veterans with tinnitus. Check if your VA provider can write a recommendation letter for medical necessity. Explore whether your supplemental insurance offers coverage for recommended supplements. For many veterans, the relatively modest cost of ginkgo supplements makes them accessible even without formal coverage, especially if they provide meaningful symptom relief. Some veterans organizations also offer assistance programs that may help cover the cost of complementary treatments not fully covered by VA benefits, such as cognitive behavioral therapy. When discussing ginkgo with your VA healthcare team, ask specifically about any ongoing research programs or special access options that might be available through your specific facility. As offerings vary considerably across the VA system, what should I do if Ginkgo Biloba doesn't help my tinnitus symptoms? If after 12 weeks of consistent use at the recommended dosage, you don't experience meaningful improvement in your tinnitus symptoms, it's reasonable to discontinue Ginkgo Biloba and explore alternative approaches. Don't be discouraged. Many veterans find that tinnitus management requires trying several different strategies before finding their optimal combination. Notify your healthcare provider about your experience, as this information helps guide next steps in your treatment plan. Consider requesting a comprehensive audiology evaluation through the VA, which may identify specific characteristics of your tinnitus that respond better to targeted interventions. Tinnitus retraining therapy, TRT, cognitive behavioral therapy, CBT, and certain types of sound therapy have strong evidence bases for tinnitus related to PTSD and may provide relief where ginkgo did not. For some veterans, prescription medications that address underlying anxiety or depression can indirectly improve tinnitus perception by changing how the brain processes and responds to the internal sounds.